Hi, good evening. This is Elizabeth Pedersen with Cook County Health. Thank you for joining us. If you have a medical question or would like to make an appointment, please call our number at 312-864-0200. Again, that number is 312-864-0200. You may also visit our website at cookcountyhealth.org. Good evening. My guest tonight is Dr. Jenny Liu, emergency medicine physician for Cook County Health and medical toxicologist for the Illinois Poison Center Toxicon Consortium. Thank you for joining us tonight.
Thank you for having me.
Tell us a little bit about what you do at Cook County Health.
Okay. Well, I've been with the Cook County Health System since 2003 when I was a resident in training, and I really love working there. I work in the ER, and I work with a great team of residents who are getting their specialty training. And I also am a medical toxicologist, and I work for the Illinois Poison Center as their medical backup. To help take care of any poison patients who have either poisoned themselves or gotten poisoned in the workplace or been accidentally poisoned for some reason. And we take care of patients for the entire state of Illinois.
Excellent. So what does that look like when you have a patient that calls in through the Illinois Poison Center? Tell us a little bit about that.
Yeah, so we have spies who man the phones at the Illinois Poison Center, and they are often pharmacists or nurses or physicians. And they answer the initial calls. We have a hotline that the hospitals can call, or even patients from their homes or physicians from their offices. They can call this hotline, and they'll be put in contact with one of our spies. And they, go ahead and, tell them what their situation is and what they need help with. And so the spies will usually give their recommendations, and they're very experienced people. They handle over 80,000 calls per year for the entire state of Illinois. Yeah.
What do you enjoy most about your job as an emergency medicine physician?
The thing I enjoy the most is interacting with people, with my colleagues, with the residents, with the nurses, with the staff, but especially with the patients. I really, really enjoy learning about the patients' lives. I meet people from all walks of life, all different kinds of personalities, and the thing that I have found the most interesting is how the social and situational aspect of a patient's life, how closely it's tied with their health care and their health. For example, like if you have a single mother who's trying to take care of kids, she needs to take care of herself in order to be able to take care of her children. Or we'll have like a homeless gentleman who can't make it to his appointments because he doesn't have a phone or he doesn't have a ride or any way to get to his appointments. So I really have grown to appreciate that intimate connection between the social, economic, and also the situational aspect of patients' lives. I mean, I really enjoy finding out about them.
Yeah, no, that's definitely part of Cook County's mission to make sure everyone has what they need. What are some of the most common types of emergency room visits that you see in children, especially as the summer months are approaching us?
Well, definitely as the summer months are approaching, we see a lot more trauma. The kids are outside, they're active, they're climbing things, they're climbing trees, they're riding bicycles. So, I'm going to see a lot more kids who are falling. They're coming with cuts or fractures. This is something that's, obviously we expect when the weather gets warmer. Other things that we commonly see would be environmental things. For example, insect bites, they might be getting bitten by a dog. Respiratory illness, especially when the pollen count gets high. Some of the asthma will act up. We'll see a lot of that, or allergic reactions, a lot of skin complaints, including rashes. Especially with the summer months, you have poison ivy that's coming out, so we have kids that are coming with that. And then, some of the typical stuff, just food poisoning. People are out having picnics. Some of the food is not really being refrigerated properly, and so people get sick from that. A whole host of different things we see in the summertime.
Okay, excellent. Thanks for letting us know. How can parents tell if they need to take their child to urgent care versus the emergency room? Obviously, there's been a lot of news about, emergency rooms being very costly for families. So how can a parent tell if they should, seek treatment at an urgent care versus an emergency room?
I think that's a really good question. Everybody has such different levels of health literacy and different levels of comfort with dealing with medical problems. So it can be a really difficult question to answer. But in general, what I would say is you would probably want to go to the emergency room if you believe or are concerned that you have either a life or limb-threatening medical issue. Versus, something that's a little bit more minor, you would want to think about maybe going to an urgent care or calling your physician first. So just some examples of something that you might want to go to an urgent care for would be, some minor cuts or scratches, if you have a cold or sore throat, if you're having back pain, some kind of rash, or maybe it's like some diarrhea. Versus, you would probably want to consider going to the emergency room if you have chest pain, if you have, difficulty breathing, if you're having severe abdominal pain, or if you've had some kind of severe trauma. The urgent cares can be a lot more quick in terms of processing you from the beginning to the end, and less expensive than the ERs. I've read that urgent care costs can per visit can be $100 to $200 per visit versus going to the ER where it's going to be upwards past $500 per visit. So, but in general, I would just say if you're concerned that you have something that might be life or limb threatening, you probably should go to the ER.
Okay. Thank you for letting us know about that. What can parents expect when bringing their children to the emergency room? Obviously, bringing small children into the emergency department can be kind of difficult because especially if someone has a couple of children with them, what can parents expect when coming in to the Cook County Health Emergency Department?
So meaning like if they're bringing their children for a complaint to the pediatric emergency side?
Yes,
Oh,
correct.
okay. It's a good question. People often complain about the long wait, and this is something I definitely do want to mention. Sometimes there is a wait because there's so many people. The staff really try to do their best to prioritize those people that have the more urgent conditions. Sometimes patients don't understand why there are patients that are going ahead of them when they arrived a little bit later. But I would say that in general, we really try to get everyone seen as soon as possible. But if somebody has uncontrolled bleeding, they may be prioritized over someone that's got an ankle sprain. But essentially, like when you arrive to the ER, you will meet a nurse who is the triage nurse, and she'll decide what your complaint is and how serious it is, and get your vital signs, and then maybe draw your blood or get you an X-ray. Some things before you actually get seen by the physician. So, but once you're put in the room, your child will be seen by the nurse that's going to be taking care of you, and also by the physician who will examine you and help to decide what kind of treatment that you need. And together, hopefully come up with a good plan to take care of your child. But I definitely would say, if to try to maximize your visit with the doctor, think ahead of what you feel like you need from the doctor so that you can communicate what your expectation is. I'm worried about cancer, or I'm worried about this in my child, and this is why I came. And that would help a lot in helping the physician understand, how to communicate better with you and how to make your visit as, effective as possible.
Excellent. There's been recent studies lately that have shown the visits for children who have swallowed small objects have actually increased. Why do you think that's the case?
So it was interesting. I didn't read the study, but I read a couple of articles about this study, which was published in Pediatrics just last month. And it was interesting because they really were looking at the ingestions of foreign bodies by children less than 6 years old. So really, they looked over a 21-year period from 1995 to 2015 to look at the trend to see. And they noticed that the number of emergency room visits for ingested foreign bodies doubled during this time. The thought is, why is this occurring? Well, the researchers, they believe it's either to better reporting methods, or it's just due to the fact that as as technology has grown, like we have so many more electronic items in our home. We have electronic toys, we have, Apple Watches, we have so many things that have small parts to them. And they're just being used a lot more in our households.
Gotcha.
But I actually do want to say something interesting, because from that study, what they actually found was they looked at 30,000 children that were less than 6 years old and looked to see what they ingested. And the most common thing, which was 62% of the time they were ingesting coins, 10% were toys, 7% was jewelry, and then 7% were batteries. And I think there were many more of the button batteries. But the ingestions that the parents should be aware of that would be the most dangerous would be, obviously sharp objects, batteries, because these little button batteries, which you can find in toys or in hearing aids, if they get lodged in your esophagus or anywhere in your GI tract, they can erode or basically eat through the tissues and cause a perforation or a hole in your GI tract, which is life-threatening. So that's why button battery ingestions are particularly dangerous. If you have magnet ingestions, that can also cause harm to your tissues. And then also ingestion of small parts that have lead, like we get calls from the Poison Center of little kids ingesting either in the aquarium, they have these lead pellets that help hold some of the toys in the aquarium down, leaded bullets, or even like some jewelry have leaded charms, which kids ingest, and they can get lead poisoning through that way. So definitely are some key ingestions which are a lot more dangerous than others.
So, if someone, for example, if you have a 2-year-old playing with a Barbie and they, for example, ingest one of the little Barbie shoes, that's probably a common one. What should a parent do for their child if that's the case?
Well, it does depend on what they swallow. So if you're just using that specific example, probably a shoe's not going to do too much. But you can always call the Poison Center, and they will help you sort whether or not it's a dangerous ingestion or whether you can follow up with your doctor in a couple of days and wait till the little foreign body passes, the little shoe passes. But the Poison Center can help guide you to whether or not to go to the emergency room right away. Like, for example, if your child swallows one of the charms on a bracelet, they can potentially get lead poisoned. Those cases are a little bit more urgent because we don't want dangerous levels of lead to build up in your child's blood system.
So something like that.
Exactly.
They should bring them into the emergency room.
Yeah,
Okay.
batteries, magnets, sharp objects, anything that might potentially contain lead should seek medical attention for sure. Yeah.
So say, children, say it's even more urgent. I guess, as we try to go through whether it's an urgent care or emergency room or 911, when should a parent, we don't want to overuse 911 and only make it for like earth-shattering emergencies. What type of examples in pediatric patients, in summer months, would you technically see where they would need to call 911?
I would definitely say any case where there's a lot of bleeding, any cases where there may be severe trauma. For example, if they fell from a high distance, obviously if they were hit by a bicycle or car. Any situation in which the child might have head trauma and is not acting normally, maybe is confused, those types of situations you definitely want to call 911. It is very difficult to specify, every little thing in which, you do or you don't want to call 911 because, as we had mentioned before, everybody has different levels of health literacy and also different levels of comfort dealing with medical issues. If the parent believes that your child or whoever you're calling for needs immediate attention or might need surgery, they should go ahead and call 911.
Yeah. Tell us a little bit about what Cook County Health does to make sure that the literacy rate of our patients is better in the emergency room. What kind of services do we offer?
And that's a great question. Our patients do come from all walks of life, so everybody has just different levels of, their understanding of things. We try to educate them in the ER. Of course, we have very limited time with them, but we try to help educate them on what their medical condition is, what medications they're going to need to take for or what treatment that they want. I think the physicians and the nurses and, the staff like have such a huge role in trying to provide our patients with the education that they need just to be able to take care of themselves. Yeah.
Okay. Again, as summer hopefully is just right around the corner, what are some safety and prevention tips that you can recommend to our audience? Again, as we head into June, July, August, and hopefully some warmer weather finally.
Definitely. Well, today's definitely a great example of closer to summer weather. So I definitely have a big list of summer tips, prevention tips. We can start even with just pool safety.
Oh, that's a good one.
Yeah. So summertime is a time when your kids are going to maybe go to their friends' houses or go other places where there might be a pool. So if your kids don't know how to swim, it's a good time to either find some community center where they're offering lessons, or just making sure that they're in the supervision of an adult, because some of these pools they may not have child guards, and if they accidentally fall in the pool or accidentally get pushed in the pool and don't know how to swim, that can be a very dangerous situation. And some of these things, like some of these summer tips I have, they're not difficult concepts, but if we don't remind ourselves constantly about them, you can forget. For pediatrics, in the summertime, everyone's more active. Everyone's visiting each other in their homes. I recommend that parents or grandparents they do a sweep of their homes and their garages, meaning do a sweep and look for any potential area where like the child could get poisoned, maybe open pill bottles or like poisons, chemicals. Making sure those things are locked away. And a fun activity that a family could do you can make it a family activity where you have the other kids search around the house and locate anything that might potentially be a danger, and then lock those things up or keep them away from your younger siblings. Other things, we may have a heat wave this summer, just protecting yourself against heat-related injuries, making sure that you stay hydrated, stay in shady places, never leave your children or pets in the car. That's something that, we have to remind each other of. When the summer months come, we also are going into the woods. We're spending a lot more times in the outdoors. So, there might be more insect bites. If you're in an area, maybe in northern Illinois, where there may be ticks, doing a tick check after you've been in a wooded area. Other things, include if, maybe there's a storm this year and the power goes out, people like sometimes turning on their generators or barbecuing in their garage. That is a high-risk way of getting a carbon monoxide poisoning, especially if you don't have a carbon monoxide poisoning detector in your house. Another thing I wanted to mention was for the 4th of July, fireworks. Every year, all across the country, people lose fingers and hands, eyes. People have even lost their lives because of fireworks. So fireworks safety, is a really important one. Should, really probably leave it to the professionals, to be honest.
Do you see a fair amount of cases come around that time?
We do. Yeah, we do. And you mix that with alcohol, and you can get a very dangerous situation. So just moderate use of some of these things. And of course, like summertime picnics, just being aware of foodborne illnesses. If you have food items that need refrigeration, making sure that you have proper ice with you if you're taking it out to the beach or on a picnic, so that you don't get poisoned or poison other people too.
Do you guys recommend the amount of time that food should be airborne? That's okay for pediatric patients to ingest the food with?
It probably depends on the food, but I would never recommend that you leave food out for more than like an hour.
Okay.
Yeah.
Okay.
As soon as the food starts getting close to room temperature, you're creating breeding grounds for bacteria.
Okay. Say a child ingests something and it's been out for longer than that, and they get a stomach ache. What should a parent do with a child that happens to?
Really depends on how sick they are. If it's just a mild stomach ache, a little diarrhea, just making sure that they hydrate themselves. Gatorade or Pedialyte. if the symptoms are a lot more severe and they've vomited multiple times or had, multiple episodes of diarrhea, especially if you're a young child, you can throw off your electrolytes. You can deplete yourself of potassium. In those cases where like the child is having a lot more symptoms of vomiting and diarrhea, you probably want to bring them to the hospital to get checked out.
Okay. Do you have any other safety tips or prevention, especially, as kids will also wind down their summer as well, that, parents should be on the lookout for?
I think like the things that I mentioned, I would just, pay attention to, like your news channels, when some of these shows on TV try to give you tips for the summer, pay attention to them. A lot of them, they're not difficult concepts, but, if you don't remind yourself, you can, you can forget to just stay aware.
Excellent. As you were saying before about, I want to go back to the study about small objects
Yes.
and them being swallowed, because that seems like a real important one for our viewers. We're distracted with social media today, and the news is going all the time. What can parents do when they buy toys from the store? Are there certain warning labels that they can go to look for? If you can tell our viewers a little bit about
Definitely.
that, Dr. Liz.
We've all like gone into the toy aisle and looked at like these fun toys, and a lot of the toys do have recommendations for ages. Let's say like not recommended for like less than 2 years of age, or recommended for 6+ in age. So I think those are also very helpful. But anytime a parent brings a toy home, they should examine it, see if all the parts are working. Sometimes the parts are defective and they may be loose. They may come off, and a child, especially when they're in that 1.5 to 3 year category, they tend to always want to put everything in their mouth. So they might have a loose part that they're just curious about and put it in their mouth and accidentally swallow it. So just checking the actual toy itself, making sure that all the parts are placed correctly or assembled correctly. And then just looking for, toys that actually have small parts that can come off, toys that use batteries. And then, even once after you've had the toy for a while, just, routinely going through all the toys and making sure that, the damaged ones get disposed of.
Okay, is there, with batteries, they have a lot of open compartments. And so what would you recommend to a parent that has an electronic toy that includes batteries to secure the opening where the batteries go? Because they're not all screwed, as you'll notice when you go down the toy aisle at all the different local stores. They're not screwed. And so that little flap that can be opened can be
Yes.
real problematic.
Exactly, and especially if that toy, if it like falls from a distance, right, it can just like pop open. It doesn't even, just a small little trauma like that can open those flaps and let that battery fall out. As much as you can possibly do, just good supervision when your kids are playing with these toys is helpful. Yeah.
Okay. Well, we have about a minute left in the show, so I want to thank Dr. Liu for being here today. Again, if you have any questions that you'd like to call in, or if you would like to make an appointment with Cook County Health, please call 312-864-0200. Again, that number is 312-864-0200. You may also visit our website at cookcountyhealth.org. We're also on social media, including Facebook, Twitter, and Instagram, where you can get health tips. Dr. Liu, would you like to just say some closing remarks to our audience this evening?
I was just hoping everyone has a safe and happy summer, and if you have any questions, come see us. We'd be happy to take care of you.
All right. Thanks again,
Thank you so
Dr.
much.
Liu,
Okay.
for being on the show. We are really happy to have you here, and hopefully you'll come back and see us, in a few months or so.
Thank you
And
so much.
hopefully
Okay.
the summer months are enjoyable for all of our Cook County residents. And make sure your kids are safe this summer. Thank you very much.
Thank you.